Hello, dear participants. We are glad to greet you on behalf of TBE Europe Coalition on a practical webinar devoted to the use of a new tool for the mapping of activities aimed at strengthening of community systems and activities on community level. This tool was developed with the funding from the Global Fund within the project on support of civil society organizations working in the TB area in the process of preparation of the application for the 7th round of GF funding. Within this project, representatives of communities, TB-affected communities, Uzbekistan, Tajikistan, Ukraine, received support which helped to the active inclusion in the development of their application and interventions in their countries in the process of development of these applications to the GF. And it helped us to take into account the needs of communities to finalize the documents, the applications, and we think that the results of mapping exercise received with the help of this tool will be helpful, not only within the preparation of the country applications, but also in the process of application development for other funding sources. And now I give the floor to Olive Mumbe, a member of the team of CRG on TB. Olive?
Thank you so much. Can you hear me, Vlada?
Da.
Thank you. I would like to thank the TB Europe Coalition for inviting the Global Fund. My name is Olive Mumba. I work within the Community Rights and Gender Department within the Global Fund. We are working in close collaboration with TBEC as one of our key and vulnerable populations regional network for TB within the Eastern and Central Europe. And I just wanted to mention that we are proud of the work that TB Europe is doing, especially making sure that the voices of communities, and not only the voices, but the spaces of communities are there, such that any issues, any needs around TB, when it comes to programmatically or when it also comes to policy-wise, that they have been included. During the Grant Cycle 7, which is a global fund cycle that makes sure that countries are developing their fund requests, we also had the opportunity through the Community Engagement Strategic Initiative, small funds that were sent to countries and to the regional networks. And we are very happy to note that from that funding, there are tools that were developed, like one of them that TBEC has developed. These tools are not only tools that are put on the shelves, and as we will be seeing and hearing, these are tools that are being used practically at country level to make sure that the needs and whatever experiences communities are experiencing can be included within the fund requests that are being developed and submitted. So I will not take long, but to just thank TBEC for this opportunity and wishing all the participants here happy deliberations. And thank you. Back over to you, Vlada.
Спасибо, Олив, за такие слова.
Thank you, Olive, for such words. We would like to thank you for your active participation in the development of concept of this document and for its improvement. And now I give the floor to Christina Chelan, author of this guideline, of this tool, who tried to make it as practical and brief as possible and as clear as possible. Clear the floor. Christina, the floor is yours. Dear colleagues, thank you, Vlada. I'm glad to see so many familiar faces, familiar names. I know that you have a translation. For me, it will be more convenient to speak in English, so I will present this document in English.
See on the screen, and you already received the link to it. If you can leave the first slide, please. And and maybe mute someone whose microphone is on. Okay. Thank you, Vlada. So this guide has been created to facilitate informed and meaningful involvement of civil society and communities in preparation to the national strategies, national programs, and funding requests that come in support of TB programs. Its primary purpose is to provide programmatic support on utilizing the Excel-based tool that you also received, which helps in mapping the community system strengthening and the community-led responses, which we will be calling further CSS and CLR, offering a specific list of actionable activities that can be implemented within countries to address the TB problem. The guide offers detailed instructions to assist civil society organizations and communities in identifying the CSS and CLR activities that are currently being executed within the country, along with all the organizations responsible for their implementation. Additionally, it helps in identifying activities that are not currently yet implemented, but have the potential to be included in the NSPs or by various funding requests, as well to monitor the inclusion of these activities during the grant making and implementation of the project. Next slide, please. So what are the community systems and response mean? And if we start from the community system strengthening, that entails a comprehensive set of strategies aimed at empowering communities and bolstering their capacity to effectively respond to TB challenges. Community system strengthening is designed to enhance TB control efforts, improve health systems, and promote people-centered, equitable, and accountable TB services. On the other side, CLR are initiatives driven by the communities to address TB-related challenges. CLR encompasses various activities undertaken by community-led organizations to promote TB control advocacy, research, and support. So here it is important to notice that community-led response activities should be implemented and proposed, developed by community-led organizations. On the other side, even some of the activities that in cases when they are implemented by community-led organizations, they refer to community-led response. In case they are not implemented by the same, being implemented, for example, by the civil society organizations or by the principal recipients, sub-recipients, different entities, national TB programs. In that case, they will qualify themselves as community system strengthening activities. In summary, the CSS and the CLR constitute complementary approaches to enhance TB control and community involvement, while the CSS focuses on the strengthening of the community systems. CLR emphasizes community-led initiatives driven by organizations to address TB challenges and promote accountability. Both approaches contribute to a more effective, people-centered TB responses and improved health outcomes. Next slide, please. So we will go now to the next slide to discuss on examples and have a clear understanding on what CSS and CLR means on different areas of implementation. And the first area will be the community-led monitoring. So in both aspects, we have this area covered, and the activities implemented as CLR in the community-led monitoring is when the community-led organizations are independently monitoring TB programs, ensuring service quality, accessibility, and responsiveness. For example, we have the community-led organization introduced a CLM tool, creates the response team, and is providing support to people in solving the individual cases, and also collect data and provide and as said, provide immediate support in solving individual problems. In CSS, the community-led monitoring empowers the communities to hold service providers accountable for delivering quality, accessible, and affordable TB services. The CLM generates data for evidence-based advocacy, ensuring service improvement. So the part that is generating the data and is making it to use for data for decision making and for improvement of the healthcare provision in general, that is referring to community system strengthening. So, for example, if the part when you develop an algorithm of data exchange within the national stakeholders, regularly presents the CLM data that shows the gaps in the provision of services, participate in advocacy for removal of the identified gaps, participate in reviewing the documents to incorporate needed changes for improvement of the TB care delivery. Everything is going to the community system strengthening part. Next slide, please. The other area where we have both community system strengthening and community-led responses present is the community-led research. And again, the community-led research as CLR is when the community-led organization is conducting the research to identify barriers, inform policy changes, and advocate for improved TB services for from the community perspective. For example, the community is conducting a CRG or a TB stigma assessment. That means the community is creating the working group, organize the prioritization meeting, organize data collection, does the data analysis, writes the report, present and validate the report with the country stakeholders. While for CSS, doing the community, when speaking the community-led research in aspects of community system strengthening, that means to generate strategic information in order to advocate for policy changes addressing social and structural barriers to TB services. That support reforms by identifying gaps and barriers. So, for example, after the CRG or TB stigma assessment, the communities and civil societies are developing a costed action plan or for example, TB stigma strategy to reduce the level of TB stigma. And this is based on the findings that has been done by the community-led organizations as a community-led response. So as you see, the both aspects are going hand on hand each to other and are informing the activities for the same. So advocating for inclusion in the NSP of the activities that can address barriers or can address stigma, which are identified based on the reports conducted, the reports developed by community-led organizations. That is already part of the community system strengthening. Next slide, please. Another area where both aspects are present, that's community engagement, linkages, and coordination, and the community-led advocacy. So when we speak about CLR in this sense, that means when community-led organization, and this is very important to make sure that we are talking about community-led organizations and not civil society organizations. So if the activity is done by the community-led organization to advocate for policy reform, social and structural barriers, changes, and resource allocation to enhance TB control and support, that is CLR. For example, organizing an advocacy campaign on TB or specific topics on TB like human rights, gender, community, stigma, and so on, prevention, care of TB. That is community-led response when implemented by community-led organization. On the other side, when we speak about this component in terms of community system strengthening, that's the part where we conduct activities that strengthen community involvement in decision-making, enhance community providers' linkages, and improve service access, and also foster participatory governance and informed health choices. So involving communities and civil society in advocacy activities like meetings, consultations, review of different documents that will influence policy changes related to TB. That means that the activities are part of the community system strengthening. Next slide, please. And the last example will be in area of capacity building and leadership development. And when we speak about the community-led response, that we are building capacity and developing leadership when the community-led organizations strengthen their own organizational capacity to effectively lead TB-related initiatives, promoting sustainable community involvement. For example, if the community-led organization is undertaking a training to provide non-medical supportive services to people affected by TB, different like referral to screening, counseling, connecting the people to support groups or assisting them with treatment as adherence, that means that it's a that's a CLR activity. While when community and civil society organizations are involved or are leading the activities to develop or adapt, for example, the standards of services, are involved or lead the advocacy to approve at the national level such standard of services, advocate for financing, that's community system strengthening activity, which empowers community-led organizations to provide peer-led TB responses, enhancing programmatic outcomes and community involvement. Next slide, please. Again, when speaking, probably not so much the differences between CSS and CLR, but how to better identify when we speak about CSS and CLR. We will look through different aspects of the activities, and the first one is the nature of intervention. The CLR pertains to a specific community-led activities such as research, monitoring, advocacy, and support services, while the CSS focuses on enhancing community systems, involving strategies like monitoring, research, engagement, and capacity building. And you'll see that some of the activities are the same, like monitoring, advocacy, research, but it depends at which stage we talk about. If we talk about the data collection or the implementation at grassroots level, that's community-led response activity. If we talk about the implementation of this activity already for decision-making or as a advocacy activities that will help the community systems to be stronger, that is community system strengthening. The other aspect is the scope. The scope of CLR primarily resolves around TB-focused activities led by the community organizations, as previously said. And the CSS encompasses a broader framework that strengthens community systems to address various health challenges, including TB. In terms of accountability, when we talk about accountability in CLR, that means that we emphasize community-led accountability, where the community-led organizations independently oversee and manage their interventions. For CSS, accountability lies with both communities and service providers, fostering improved service delivery. Talking about engagement with the health systems, the CLR may operate partially outside the formal health systems, with community-led organizations driving interventions independently. And the CSS aims to reinforce health systems by empowering communities and improving coordination with formal health institutions. And when we talk about funding and management, the CLR initiatives are often managed by community-led organizations, independently funded through contracts or grants, promoting community ownership, while the CSS interventions may be supported through various funding channels, including the Global Fund, and are managed collaboratively. Next slide, please. And I will talk a bit about the mapping exercise before going to the Excel based tool, which will show you how to use it. But here I will stop a bit on the process. First of all, this should be an inclusive process. With the engagement of all the relevant stakeholders in the country. So in this sense, the lead organization that wants to use this tool should ensure that the process is inclusive, all partners are engaged, all the TB-affected communities and key and vulnerable populations organizations are present at the meeting. In this sense, probably the CCM Secretariat is of help, as they know all the organizations and all the initiatives present in country. So with the support of the CCM, the community-led or the civil society organization that want to undertake this exercise should gather the list of all relevant stakeholders and invite them. It would be good to circulate in advance the tool so people knows what is in it and come to the meeting prepared. Have at least one half-day meeting to discuss each activity in detail. It is important to make sure that all activities are very well understood by all the participants, and for this we have the Annex A in the guide that explains very well each of the activities that are currently included in the tool. And as previously said, that's a living tool. Now, there you have some templates of activities that are currently relevant for our region, but of course, not all of them should be relevant for all the countries, and maybe some of the countries have some specific activities. That's why this tool will be a living one, and we can include new activities. So after the meeting you have with the discussions and the rating attributed to each of the activity, that should be, the process should be documented to ensure the list of activities that need to be implemented in the country are well prioritized, and the priorities are agreed among the partners. By conducting such review, you can potentially gain a better understanding of a landscape of active TB affected community, first of all in civil society organizations, in big countries where not all the time all the organizations are closely collaborating, understand better their roles, contributions, and the scope of their engagement in TB response efforts, which will help significantly during the mapping exercise. Next slide, please. So now we will go to the mapping tool itself, and I will ask so I can share my screen, Vlada, correct?
Okay.
Okay, so I'll share my screen now. Are you able to see my screen? And is okay. So the Excel tool that you probably already had the chance to look at has 4 pages, and the first page is the cover page, which make a short introduction in the scope of this tool, and here you also can access the other free pages. And the first one is the instructions, where you'll find how to fill in this tool. The second one is the page where the data entry is taking place. And the third one is the page where, based on the data you entered, you'll have the status for each of the activities. Оксана,
Пытаемся найти, кто не выключил микрофон. Секундочку.
Okay, I think Oksana has her phone on, and it's probably in her pocket. That's why it's constantly.
Yeah, that's true. I'm sorry.
No. Thank you. Okay, so we'll go to the page with the instructions. And here you have the short guidance on how to complete the tool. What is important in this page, you need to select from the drop down cell the country that you are working with, and I will probably choose Moldova, as I know the best the situation. And also on this page, it is important to choose the year when this exercise is conducted. This will influence a lot. So if you skip any of these steps, that might influence your results in the end. And then you need to choose how many organizations you have in the TB response in country. Let's say 8. And from those who are active, we have 7 attending the event, or in the best scenario, that will be 8. All of them are attending. So when you go on the and here you'll have the explanations on how to fill in each of the columns and rows in the data entry, but I will prefer to show you. So first of all, we have the template activities, which are structured according the modular framework of the Global Fund, and that will help a lot the communities when preparing the funding, the interventions, the priority interventions for the funding requests. That will help to give them exactly the module or the intervention that this activity is part of. You'll have the status of the implementation, year of completion, some comment or sources if you have it to the document documenting this process. And here you can include the names of the organizations that you have. And as I said, in Moldova, we have, for example, PAS Center, we have SMIT, we have Speranța Teri, we have the Union for Health Equity. Yeah. So probably I will not write it very correct now, and the other colleagues that are present and are active in TB response in the country. So here you include all the organizations that are active and are active in TB control in the country. If not all of them are present at the meeting anyway, you include all of them, because some of the activities might be were conducted by one of the organizations that is not present currently at the meeting, but we know they implemented such activity. We will go probably on each of the activities, 2-3 activities, just to see how you fill in the tool. The conduction of the CRG assessment. You have here also drop down from which you will be selecting, and it's not applicable because the country does not need one and do not see, not the country, but the communities do not see the relevance of conducting one. It is not planned. The communities see the relevance, but unfortunately did not have yet the opportunity to plan. It is planned and financed. It is, for example, it is included in the next Global Fund grant, and we know that that will be financed for sure. It is planned as our work plan, but it is not financed. We included, for example, in the Global Fund funding request, but it was not accepted neither in the main funding request nor in PAR. It can be in progress, already being conducted in current grant, or completed, previously done. For Moldova, we have it completed, and it was completed in 2022. If I'm not wrong, but I should not be. Okay. And here you can put the link to the website where this CRG assessment is published, and who were the implementers. That was implemented by PAS Center, SMIT, and AFI, but as well other organizations were part of. So the leading organization were those three, but when talking about data collection and the people that were interviewed from different organizations, they also took part of it. So all the TB organizations, as far as I remember, were part of the working group and focus groups and so on. So, and here we will add once again the number of the organizations that participated in this process. The next one is the CRG costed action plan, and actually it will be the same as CRG assessment, but for the sake of the exercise, I will put that it's not applicable. And the year of completion, of course, it's not applicable as well, as we consider that we do not need a CRG action plan. And of course, all the responses will be again not applicable. Okay. And again, not applicable. Advocacy activities to remove identified CRG activities. Let's imagine that we do not plan such. So in case we do not plan that will be not applicable. And again, anyone will go to not applicable scenario, because anyone will not implement these activities. Okay. I'll try to take 2-3 more examples to have different scenarios in place. Advocacy activities for CRG prioritization and inclusion in the national TB response. We will choose it as planned and financed. And if it is planned, then it will be starting with 2024. And we will have PASS Center not implementing, we will have SMIT, yes, we will have Speranza Terry, yes, the health union, yes, AFI, no, the other implementers, yes, no, no. And then we will see how many of the organizations will be implementing this. So we'll have 4 organizations implementing this. Conduct stigma assessment to assess level of TB stigma. For example, we will say that this is planned and financed for 2024. But we will have just one organization conducting this, not the others. Conduct a knowledge, attitude, and practices study to assess knowledge, attitudes, and practices of population of TB. That is planned but not financed. And of course, if it's not financed, we will choose not applicable the year of completion, because we do not know when we'll have money. And we will have again no one implementing, because we do not know yet who will be implementing, who will get the money for this. I'll probably stop here. There are different scenarios, but I'll look at the time, and I'm conscious that we also need to have time for Q&A. So we will go to the page where the status is. You can go from the home, you can go here directly, or you can go from the home page, and you'll have here different colors for each of the activities. And we will look at those who are which are green. That means that we are okay with these activities. They either are being implemented or are being financed, planned and financed. There is sufficient organizations involved in this activity, and so on. We'll have the yellow ones, which means that probably we have planned them, but we do not have sufficient financing. That means that this this activity should be included in a next funding opportunity, and we will have activities colored in red. That means that we even either they are not financed, they are not planned, or we do not, or they might have been implemented long time ago and they are not relevant anymore. The result is not relevant anymore. So the red ones are very, very important, the ones that we should take special look, deep look into it, how on the situation we have in the country with this activity, and when prioritizing the activities for the funding request and for the NSPs, we should look first of all of those which are red, then those which are yellow, and then we go to those which are gray. The gray one, if you go to the instructions, you'll have this here also explained. Okay, just a moment. So here you have the explanation of each of the colors, and when speaking about the gray ones, it should be those need the most discussion and agreement among the partners, because they can be good. For example, the country does not need such activities. We do not need any CRG activities because we are doing great at the CRG aspects. There is no discrimination based on gender, community appartenance, or human rights violation, or that should be interpreted like very poor. There is a problem in the country, and even the communities, civil society that are doing this exercise are not completely aware of the fact that this can be a problem for the country. So I'll stop here with the tool, and probably there will be more questions on this, and probably when you will start implementing it, there will appear different questions, and I will go to the annex in the guide. Okay, let me share. Just briefly to show you.
Я зашерю презентацию, Кристина.
I can share the presentation.
I have it already. It's okay. So you have the guide, and in the guide you have the Annex A, where you have the explanation of each of the activities which is currently included in the Excel tool. So in case you are not quite sure about what each of the activity means, you should go to the Annex A, where you have a short description for each of the activities, and where you will also find additional resources for this, either examples of similar activities undertaken by different countries, or any resources that can be helpful in conducting such an activity in your country. When speaking about the TBEC assessment, we go to the additional resources that we have on Stop TB partnership, and which is the investment package for CRG assessment. So, and this annex is done for all the activities that currently are part of the Excel tool. But again, as said in the beginning, we have only templates of activities that we found them relevant currently for the countries in our region. If the tool is being adapted for other regions, for example, or for other countries, or in time there will be new activities that might be part of this tool, we have in the end rows where we can ourselves include new interventions, new models, new template activities, and they will be shown on the next page as well. So I think here I will stop, and I went through the entire presentation, just the slide saying thank you to everyone, and probably we will have 10 minutes of Q&A. Vlada, over to you.
Кристина, спасибо большое за
Thank you so
презентацию.
much, Christina, for your presentation and for the tips on practical application of the tool. We already have interested participants. They are looking forward to obtaining this tool, and we believe that we still will have the 4 windows from 4 to 7 for application of submission of country applications. And for those countries, this tool will be especially relevant. It will help them develop their or formulate their needs and interventions, and to see what should be implemented. And we have a comment from Nona in the chat about that. Maybe it should be necessary to add to the tool a separate column indicating the number of organizations. That answer, yes. The organizations that implement certain interventions. We will think about that. Thank you, Nona.
To respond, I think the comment that Nona had is to automatically calculate how many responded yes or no. So we have it, but it does not count currently automatically. I was exploring this option. I was thinking the same, but unfortunately couldn't technically it couldn't be done. So probably if there will be more advanced users in Excel that can suggest how this can be done, that really will be helpful. Thank you.
Спасибо, Кристина.
Thank you, Christina. Do we have any other questions, colleagues? Maybe you'd like to clarify some aspects.
And I can also respond in Russian for easier communication. Я тоже могу на русском ответить.
I can also respond in Russian. It was just more convenient for me to present in English, but otherwise I can speak Russian as well if you have any questions. I believe that the presentation and the tool that has been developed, they are so clear that participants have no questions. But I believe that when you start implementing using this tool, you will have further questions, and we are always happy to answer, to address them. If you need any advice, you can write to us, and we will be happy to support you and to do whatever we can do. All the proceedings from this meeting will be sent to the participants, including the tool. And it is also indicated in our guidance, so you will have the opportunity to familiarize, to download, to fill in the instrument. If you have no questions, I would ask you, and maybe we should also add that they will also be available in Russian. Right. The guidelines and the tool are accessible both in English and in Russian, and we will provide all of that to you. Thank you for activating your cameras. Thank you so much for your participation, for your comments, and Nona, thank you. Lesia, will you tell us when we can stop smiling? Smiling is good, but you can stop now. Okay, and thank you again for your participation, for your interest for the tool, and see you next time.